After a hard day of frame-mogging the normies, do you ever return to the crushing silence of your bed-frameless bachelor pad and think, what the hell is going on? You are not alone. Unfortunately, millions of young men are facing mental health issues without a clear roadmap on how to get help. Instead, they are falling into communities that tell them that the answer to all of their fears and anxieties and trauma is to smack their jaws with hammers, take peptides, and submit parlays. Now, I know I came in hot and probably ruffled some feathers, but in order to placate your fears of this being a video of a guy talking down to you, I can do this. Whoa, that's kind of crazy. Allow this to be the virtual extension of the olive branch, demonstrating that you and I are not too dissimilar. I am not here to demoralize you or your way of life. No, this video will be real, actionable steps that any of you can take to seek help for what ails you. This video will dive into the data behind men's mental health struggles and their reluctance to seek help and how to actually find help.
Part 1. Why am I making this video specifically?
Young people generally are facing a mental health epidemic, and young men are represented in the data in a uniquely concerning way. Even if not all of us are feeling it, we've all heard of the mental health crisis that is plaguing many of our peers. An article in the Rhode Island Medical Journal titled Young Adult Male and Restrictive Masculinity Norms states that in 2022, over 1/3, 36.2%, of young adults aged 18 to 25 experienced mental illness, the highest among all age groups, and 11.6% face serious mental illness. If you hung out with two of your friends right now, you could pretty safely bet that at least one of you is facing a mental health struggle right now. To put that in perspective, Nathan Swellitz, in a piece for the American Medical Association Journal of Ethics, says the following: men are diagnosed with depression at half the rate as women. However, disturbingly and paradoxically, men are 3 to 4 times more likely to die by suicide than women. Further research has been done to show that some of this gap has to do with the methodology differences between men and women, with men more likely committing using a firearm, which is inherently more deadly. However, implicit in this data is the phenomenon that men are less likely to seek help, but are still suffering the consequences of the mental health crisis all the same. According to data from the National Health Services in the UK, male identifying 18 to 25-year-olds accounted for less than 30% of referrals. It begs the question, why are men not seeking help? Young men are less likely to seek help for mental health because of restrictive male gender norms and a lack of literacy on mental health issues. From that same article in the Rhode Island Medical Journal, restrictive male norms are overly confining ideals about what it means to be a man, with expectations that emphasize emotional toughness, self-reliance, dominance, anti-femininity, aggression, and risk-taking. That's not bullshit. We all know what I'm talking about here. If you grew up in the West, you were socialized in a certain way that left a very narrow bandwidth for which to express yourself as a man. We probably all face a time in our lives where our very real fears and anxieties have been waved away under the guise of needing to be more manly or needing to toughen up. A few of you probably had your guards raised when I said that, so let me throw the deadlift back on screen, okay? All right, I'm not here to scare you. But we have to acknowledge that men's aversion to seeking help is a product of a culture that has been bred and perpetuated. The data backs this up. From a 2023 meta-review in the European Child and Adolescent Psychiatry Journal, researchers found conformity to masculine social norms, or CMNs as they call them, is a barrier to adolescent boys and young men's health seeking for mental health, often due to the stigmatization of mental health difficulties being seen as a weakness. From the research reviewed in the study, many young men found help seeking to be embarrassing and contradictory to masculine stereotypes. This conformity to masculine social norms not only created an external pressure to conform, as in from other men, but also an internal self-stigma. Young men came to believe that help seeking is a personal failure, as they have been unable to solve the problem themselves. And this self-stigma bleeds into help seeking avoidance from family and friends and peers, not only professional help seeking avoidance. Help avoidance also positively correlates to other avoidance behaviors such as substance abuse and gambling. So this external pressure to conform and this internal pressure to problem solve just leads men to retreat into themselves rather than actually getting to the root of the issue. Young men also possess low literacy on mental health disorders and treatments, so they don't know that many disorders are treatable and what is actually available to them. To continue with the study in the European Child and Adolescent Psychiatry Journal, the research group found that a lack of knowing where to go to get help served as a barrier, as well as a fear of being prescribed medication from health professionals if they were to divulge mental health concerns. To corroborate these findings, I like to point to a 2016 study done in the Journal of Mental Health, where researchers administered a test to 901 Canadian men and women to examine the sex differences in mental health literacy between men and women with respect to men's mental health and suicide specifically. I know that's a mouthful and probably doesn't make a lot of sense, but to give you a gist of how the study worked, the researchers administered 2 pre-existing and established literacy surveys on depression and suicide to the sample population. They didn't tweak the language on the surveys to make it more male-centered. So rather than saying people who sleep too often are showing signs of depression, it would say something like men who sleep too often are demonstrating signs of depression. They didn't gather the results and compared the data between men and women. The researchers concluded that their study confirms misconceptions and uncertainty about men's depression, wherein many depressive symptoms are poorly misunderstood or differentiated from other mental illness. In fact, the study suggested that females have higher literacy about men's depression than men themselves. To illustrate this, for the depression literacy survey, the proportion of correct responses were significantly higher among females compared to males, 70.8% versus 63.3% with a p-value less than 0.017. And women submitted far fewer incorrect responses than men, 9.1% versus 16.6%. One example is on the survey item, sleeping too much or too little may be a sign of men's depression, where 90.3% of women answered correctly compared to 74.8% of men, a difference of 15.5%, the highest of the study. The study closes by saying, in light of the current study findings and given the evidence that mental health knowledge can increase with education, which in turn reduces stigma and improves help-seeking behaviors and treatment adherence in patients with depression, concerted efforts are needed to advance mental health literacy about men's depression and suicide. If you want to know why young men do not seek professional help, it's because they don't want to stigmatize themselves to other young men. They perceive help-seeking as a failure of their obligations as men, and many of them don't really know that much about mental health issues and what treatments are available to them. So, where are men going instead?
Part 2. Online content.
Online content geared towards men's self-improvement has mixed to negative health outcomes for those who engage with it. From the 2025 Movember Institute of Men's Health report titled Young Men's Health in a Digital World, researchers found that roughly 2/3 of young men in Australia, United Kingdom, and the United States, 63%, are regularly engaging with men and masculinity influencers. The report uncovers fascinating data about the who and why of those who engage with this type of content, and I highly recommend you go read it. One of the most revealing discoveries is in the mental health outcomes for those surveyed. While young men who engage with this type of content self-reported higher optimism about themselves and other men's futures than those who are not engaged with this content, those same young men also reported significantly higher levels of worthlessness, nervousness, and sadness. These men and boys who engage with this type of content are less likely to prioritize their mental health and spend time with their friends and family, both of which are success factors for well-being. So it appeared to me that a lot of this content is soothing and reassuring for young men in this chaotic world, and I respect and validate those feelings. But I can also see how for many of them, this content is a sugar pill, not the real thing. To expand on these findings, I point as well to a study in the Sociology of Health and Illness Journal in 2025 titled When Health is Harmed, Health, Lookism, and Self-Improvement in the Manosphere, that examined the more toxic subculture of looksmaxxing in the men's self-improvement community. To give you a little peek into the methodology of this paper, the study entailed examining a popular looksmaxxing community website that receives millions of unique visitors per month, hosts tens of thousands of members, and contains millions of comments. From this website, the researchers sampled 5,327 comments on a looksmaxxing discussion board where users discuss fitness, style, and surgery with the goal of self-improvement, and 2,745 comments from a ratings discussion board where users post their pictures and ask for ratings and advice from other members. After analyzing these samples, the researchers argued the following. Men participate in looksmaxxing because they position the community as providing objective information about their bodies and concrete advice about how to improve their looks. Self-improvement is not inherently harmful, and these men seek to enhance their self-esteem, self-image, and lives. However, we demonstrate that they are instead subjugated to a hegemonic masculine gaze that caustically evaluates them in relation to and unachievable masculine ideal. After receiving such evaluations, men report engaging in substantial, expensive, and potentially harmful health interventions. They are also subject to masculine demoralization, which positions them as failed men and encourages self-harm. We have demonstrated that while operating under the guise of self-improvement, looksmaxxing harms the health of men and boys. To break down this quote a bit, these spaces become less about men helping other men on their self-improvement journeys and devolve into men denigrating other men in this sadomasochistic ritual as they compare them to this unattainable, Chad status or whatever. Where we talked about young men feeling an external pressure to conform to these masculine self-norms, these spaces transform that external pressure into virtual daggers and knives. The study calls this masculine demoralization as exemplified by this selected comment from the ratings board. Death to your mouth to nose ratio, death to your philtrum to chin ratio, death to your nose, death to your philtrum length, death to your eyes, just give up. Self-harm ranging from bone smashing all the way up to suicide is not only allowed in these communities, but encouraged as men see themselves and other men fail to live up to these codified masculine standards that they've made. Given all this, I'm not sure how any of these spaces can be called men's self-improvement communities. The results and intentions do not align with the goal. To close the loop, is online content working? No, these spaces are ineffective substitutes for real help seeking that men desperately need. Not only that, a lot of these spaces are racist, homophobic, transphobic, every ism and phobic that you can possibly imagine. The last study had some of the most bleak and insane quotes I've ever read. And I've read Coin Locker Babies by Ryu Murakami. So a lot of these spaces aren't even for all types of men. I simply didn't want to balloon this video's length, and I kind of don't feel equipped to talk about all that stuff. If you want to know more about the sociology, you can check out these studies, or I defer to someone more knowledge or well-read like an FD signifier.
Part 3. How do you actually find a therapist? With the groundwork laid, let's get into why y'all are actually here. I am going to give you all a step-by-step guide on how to find a therapist. These instructions will be informed by my own experience finding a therapist, along with some tips from the book Quarter Life: The Search for Self in Early Adulthood by Satya Doyle Biak. Sorry for butchering your last name, Dr. Biak. Real sorry. The book was instrumental to my own mental health help-seeking journey and my own conceptualization as a 20-something, so I have to give the book a shout out. I would totally recommend reading it. Alright, let's jump right into it. So step 1, you're going to want to navigate to an online directory such as Psychology Today or goodtherapy.org. I personally use Psychology Today when I began my mental health improvement journey. You're going to want to find something that says find a therapist or find a professional, and then you're going to want to input your location. You guys are not getting my location, so let's just pick let's go New York. Shout out Knicks. So you're then going to want to open the filters and find the insurance filter. Now input your insurance type. This is probably part of the process that will be the hardest. I was privileged enough to have medical insurance via my mom and the support of her to seek help. And then once I aged out of her medical insurance, I was a full-time employee with health benefits, so I was able to continue seeking help. If you're under the age of 26, you will be a dependent on your parents' medical insurance, if they have it, that is. You'll need to figure out who your provider is. This may be a source of conflict between you and your parents. If you need to, just straight up lie to them, right? Tell them David gave you permission. David on the internet gave you permission. Tell them that you want to see a dentist or something, or that you need it for some paperwork at school if you're in college. Ultimately, you have to make the determination of whether avoiding conflict with your parents is worth not getting help and suffering in silence. If that's just not an option for you, many therapists will work with you to pay for your sessions. In the filters, look for a filter called sliding scale. This means that the therapist offers discounted rates for those facing financial hardships or those without insurance. You could also look into pre-licensed clinicians. We'll talk about them a little more later. They're postgrads who are trying to gain hours for licensure, who often work at discounted rates. They are supervised by a licensed clinician, so it isn't being stuck with an intern or something. They do excellent work as well. So after inputting your insurance, you're going to want to input any other filters that you feel are relevant to what you are looking for in a therapist, like gender, ethnicity, in person versus online, etc. Now you have this like huge list of people, and you want to narrow that down to people with licensed credentials. Ideally, you are looking for people who have an LPC or LCSW after their name. These acronyms stand for Licensed Professional Counselor and Licensed Clinical Social Worker, respectively. There are other like acronyms out there. I would advise you to like look them up to see what they do, like what they mean, in order to like make your decision. But LPC and LCSW are like the most common. They're both credentials that require advanced degrees and over 3,000 hours of supervised clinical practice. These people are more than qualified to help you. The main difference between LPC and LCSW is that the LCSW will also examine the social and environmental factors that are affecting you, and they are also often working within communities to intervene with at-risk populations. An APC, or sometimes you'll see it as like pre-licensed professional, they are like an associate professional counselor and someone who is working under the supervision of someone who is licensed to reach their required certification hours. So that's like that pre-licensure thing I was talking about earlier. Okay, you're gonna want to go through the like list of people on the website and select 5 people. The reason being is that not everyone you select will have availability, or if they do have availability, it like may not line up with yours. So you want to like pick 5 people just to be safe. You don't want to put all your eggs in like one basket. So after selecting your 5 people, you want to email all 5 of them to just inquire about their availability. Getting to this step has probably already been like the hardest part of this whole process. So don't overcomplicate it. Don't feel the need to like justify yourself to the therapist or like list out all your reasons or whatever, right? Just try and give like a general overview. Like you'll really get into that stuff in session with them. So they just kind of want to like get a feel for why you're even like reaching out. If you're having trouble drafting an email, I'll leave a sample one in the description below. So after you send out those emails, you're all done. At that point, you just want to wait to hear back from them. You're going to get some people who, don't have availability, which, will narrow down your list. You'll probably get some therapists who just have like additional follow-up questions. A lot of them are very responsive. Like they want to help people. That's why they got into this. So expect to hear responses back pretty quickly. I would just keep the list too. Like even if you find a therapist that seems to work with your availability and stuff like that, if you go to that first session and it doesn't feel good, you might want to like fall back to a different person. So just keep your list on hand and tell that to anyone, like any therapist who reaches out, that you don't end up booking a session with. Just let them know like, hey, I'll keep in contact though. Okay. But yeah, that's like really it. It's like 10 steps in total. So good job. I'm proud of you for getting this far. Part 4. Why am I specifically making this video?
We outside. Rejoice, rejoice. Shout out McKinley Dixon. I figured we've been talking about some heavy stuff in this video, so let's go outside, touch some grass, release some of that pressure while we close out this video. And unfortunately, beautiful part of the human experience is that right message, wrong messenger is a real thing. When I was looking up how to find a therapist on YouTube, and after scrolling past all of the BetterHelp ads, which is crazy, YouTube, that's crazy, I couldn't find a single person who looked like me talking about this subject. Or really, I couldn't find anyone that I thought a young man would click on to find this advice. Maybe Dr. K, since he's in the gaming space, but with anti-intellectualism and skepticism toward professionals at an all-time high, I don't even know if he would get a view. The fact of the matter is that I look like a lot of you, and I don't have like a special title before my name. No, I just lift weights. I play Fallout New Vegas for like 10 hours straight, and I watch that one Tavon Austin highlight tape when I'm bored. Basically, I'm a pretty normal guy. I'm also black, if you hadn't noticed. One thing I didn't mention in the first part of the video is that racial minorities feel like an additional layer of social pressure to conform to masculine norms. So part of the reason that I made this video is that I'm hoping a familiar face will be enough to capture the attention of a lot of the young men that need to hear what's in this video. The other reason that I made this video is that I was in the same situation that a lot of you are in right now. I'm 27, but I genuinely didn't know that I would make it past age 25. I probably spent most of my life depressed. I remember as early as elementary school having days where it was hard to get out of bed. But for a variety of reasons, I never got the help I needed. Because of that, my issues were allowed to fester and fester. I told myself that it was just something I needed to push through, and that if I worked harder and harder, eventually I would break through and I would be happy. I thought that was just the journey of becoming a man. But my mental health never improved, but life marched on. And it marched all over me, to be frank. It threw me a series of tragedies, and then a global quarantine happened, and I got locked alone in this shoebox-sized apartment. In that confinement, I was forced to sit with my depression, and I became frustrated. And this frustration built into this self-resentment. The resentment got so bad that for a large swath of my life, I couldn't even look myself in the eyes in my own reflection. I would see myself in the mirror and avert my gaze and shrink into myself. That resentment became this vitriol that spilled out of me, and I became a bad person to be around. In that period of my life, I was genuinely like a terrible partner, brother, cousin, and son. It all culminated in me hurting someone that I loved very dearly and destroying this life that I was building for myself at the time. And as my life was kind of crashing down all around me, I remember my mom saying to me, "You haven't been the same since your dad died." And that remains the most haunting moment in my life. To know that everyone around me could see how badly I was hurting. The woman who raised me and knows me better than I know myself at times had validated all these feelings I've been feeling for years at this point. I remember feeling this disorienting mixture of pain, anger, sadness, and hopelessness, but most importantly, relief. Someone had finally said we were all thinking. Someone had talked about the elephant in the room. Someone had validated that I was hurting. It genuinely broke me, not only emotionally, but it also shattered this lie that I was telling myself that this is what I needed to become a man. So at 25 years old, I basically restarted my life, and part of that was seeking help, professional help. So now, this year, I turned 28, and not every day is perfect, but more often than not, I can look myself in the eyes in the morning and be happy for the guy who looks back. And I know my experience isn't unique to me. It's something a lot of young men are going through right now, so that's why I made this video. I am not the perfect messenger for this video. I will leave my citations in the description below for further research and analysis. Maybe I'll also drop some other male content creators down there who I admire, who have been openly vocal about mental health issues. I had a lot of apprehension towards making this video. For one, I've just never done anything like this. I've mostly just been dabbling in shorts, and it's all music related, so this is an entirely different field for me. Secondly, I'm not a healthcare professional, and I don't want to speak over them. I am completely open to a professional correcting me or adding on to anything I've said here. Again, I'm not the perfect messenger. However, based on the research I've done, I don't think most men are looking for the perfect messenger. They're just looking for a messenger. Another man who would give them a pass to seek help. I know that's what I was looking for when I was staring up from rock bottom. I want to leave this long ass video with one more message. Some of you who watch this video will follow my advice immediately. This video will strike a chord with you. For others in the crowd, you will have to let this video sit with you before you act. I imagine an even larger proportion of the audience will never follow any of the advice I gave here, and this video may have in fact even upset you. Regardless of what you choose, I just ask that all of you be kind to yourselves. Self-flagellation disguised as manly self-discipline will not help you. Life is hard enough already as is, so I just ask that every single one of you, just be gentle to yourselves.